Hello, everyone, and welcome to Medicare 101, the 2025 edition. There have been some major changes that have happened within Medicare in the year of 2025, and we're going to make sure we highlight some of those changes here in this presentation. My name is Rocco Avellino, and I want to thank you for the opportunity to talk to you today about the basics of Medicare. And for many, Medicare is like learning a new language. So today we're going to be learning a new language, and hopefully you can be somewhat fluent in it by the end of this presentation. So on our agenda here, we're going to be talking about what is Medicare, who is eligible for Medicare, what are the parts, the costs associated with it, how to enroll, the options available to you, a Medicare Supplement versus a Medicare Advantage plan, and then last but not least, Part D. So Medicare is health insurance for older and disabled Americans and currently serves more than 62.8 million people in the United States. It's funded in part by federal payroll taxes that are paid by employees and employers. The tax is labeled as FICA on your pay stubs. Medicare is individual insurance, which may be confusing if you're used to getting coverage for yourself, your spouse, and your children through an employer plan. Medicare is not free, and you'll have some costs to pay, which we'll cover in just a bit. And finally, Medicare is different from Social Security. As you might guess, there are eligibility requirements for Medicare. First, Medicare is for U.S. citizens and for legal residents living in the U.S. for at least the previous 5 years. You must also meet one of the following requirements: be age 65, younger than 65, with a qualifying disability, and have received disability benefits for 24 months, or any age with a diagnosis of end-stage renal disease or ALS. Each individual enrolled in Medicare gets a card with a unique number on it. Numbers are randomly generated and assigned. A side note, those numbers used to be individuals' Social Security numbers until they realized that there was fraud potentials with that. So the parts of Medicare are Part A, which covers hospital coverage. That is covered underneath the FICA taxes, and we'll go more into that later. Part B, medical coverage. Part B will have an additional premium you'll have to pay on a monthly basis. Part C is for Medicare Advantage plans. Part D is representing prescription drug plans. So Part A qualification. Like we mentioned, Part A comes at no cost if you or your spouse have worked for 40 quarters and paid into FICA taxes for those 10 years. If your spouse has passed, you must have been married for at least 10 years to claim premium-free Part A under their work history. You must also be a U.S. citizen or a legal U.S. resident for at least 5 continuous years. Part A coverage is hospital coverage. That covers inpatient hospital care. Let's not get this confused with outpatient services. Outpatient is where you're in the hospital and out of the hospital within the same day. Inpatient is where you're going to be staying overnight inside that hospital. Part A coverage helps assist with skilled nursing facilities, hospice care, and limited home health care. This is not a complete list of the coverage available. So Part A costs for 2025. If you do have to go inpatient hospital visit, there is a deductible for days 1 through 60. That deductible is $1,676. So if you're in the hospital for 1 day, you'll be required and responsible to pay the $1,676 deductible for Part A coverage. If you're in the hospital for 60 days, it's all covered underneath that $1,676. If you do need to be in the hospital for 61 through 90 days, you'll be paying $419 per day while on Medicare Part A only. Daily coinsurance for lifetime reserve days, inpatient, So again, if you're staying in the hospital for 90 to 150 days, it then converts to $838 per day. With skilled nursing facility, you'll be looking at, for days 21 through 100, $210.50 per day. Now, underneath Medicare Part B, or medical insurance, this covers your doctor visits and preventive services, your outpatient surgeries, diagnostic screenings, your emergency care, and your durable medical equipment. On average, an individual will be paying somewhere around $185 per month for their Part B premiums. Now, please understand that you will pay a higher premium if your income is more than $106,000 if you're filing as an individual, or $212,000 if you are married and file joint tax return. If you'd like to, take a quick screenshot of the list here. This shows the cost associated with Part B if you are making over the $106,000 individually, or $212,000 a year joint. Now, Part B, late enrollment penalty. We want to make sure that when it comes to Medicare, we're avoiding any type of late enrollment penalties involved. And that's where having an agent to help assist you can be very beneficial on making sure that you're provided with the right context and the right times in which to enroll. But when it comes to Part B, the late enrollment, if you did not sign up for Part B when first eligible and not covered by credible employer plan, you may have to pay a late enrollment penalty for as long as you have Part B. The monthly cost may go up 10% for each full 12-month period that you could have had Part B but you did not enroll. You do not have to pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. Enrolling in Medicare. If you're already withdrawing from Social Security, you will automatically be enrolled in Medicare when you turn 65. If you are not withdrawing from Social Security yet, you do need to apply for Medicare online at ssa.gov or over the phone with Social Security at 1-800-772-1213. If you sign up for Parts A and B when you are first eligible, you can avoid any of those penalties. So when does your coverage start? Well, Medicare typically starts on the first of your birthday month. If your birthday falls on the first day of the month, then your Medicare will begin on the first day of the prior month. Here's an example. My birth date is January 19. My Medicare will start on January the 1st when I come to Medicare eligibility. If I was born on January the 1st, my Medicare would start on December the 1st, the month prior. Your enrollment periods. These are important to keep in consideration. Your initial enrollment period, which is known as the IEP. This is the 7th month, turning 65 election period, 3 months before your birthday month, the month of your birthday, and 3 months after your birthday. Again, it's a 7-month period, 3 months before your birthday month, and then 3 months after your birthday month. The special enrollment period, known as an SEP, is where there's a special circumstance within the year to be able to enroll you into a Medicare plan. Medicare Advantage. Medicare Advantage offers an annual enrollment period known as the AEP. That lasts from October the 15th to December the 7th, in which you can enroll for a program or a plan that would go into effect on January 1st of the next year. The open enrollment period, known as the OEP, is from January 1st to March 31st, where if you are trialing a plan that you did not like, you can look to move to another plan. Medicare Supplement enrollment period. There is a 6-month window that begins on your Part B effective date, of your 65th birthday, whichever is later. No medical underwriting during the initial 6-month enrollment period. Now, this is important when looking at a Medicare Supplement plan, because typically they require you to do medical underwriting. But during this period, the 6-month window, you do not require to do any medical underwriting to be a part of a Medicare Supplement plan. You can choose from any Medicare Supplement plan options at this time. So let's go a little bit deeper into the AEP. The annual election period, the AEP, again from October the 15th to December the 7th each year. You may switch to Original Medicare. You can change your Medicare Advantage plan or stay enrolled in the current plan. And again, the new coverage begins on January the 1st. Are you still working and looking to delay your Part B? Covered through an employer with more than 20 employees, there is an option to delay Part B. Make sure you consult with a benefits coordinator. An SEP, a special election period, exists to enroll in Part B anytime once that coverage ends. This SEP will last 8 months. Again, remember, the big important part here is, are you covered through an employer with more than 20 employees? So let's look at the options that you have available to you with Medicare. You can go with option 1, which is where you just have Medicare by itself. Medicare has Part A. You can pay for the premium for Part B. Now, you're going to be covered by 80% of your benefits from Medicare, but 20% will be left over for you to be responsible for. That 20% can be a very, very big question mark on what the total might be. So you always want to look at another option available for some type of extra protection. Again, option 1 was just Medicare by itself. Another important fact is that Medicare does not cover prescription drugs, so you will want to couple it with a prescription drug coverage. Option 2 is where you have Original Medicare covering your 80%. You look at a Medicare Supplement plan that will cover the other remaining 20%. Now, Medicare and Medicare Supplement plans do not cover prescription drugs, so you will want to couple that with a Part D prescription drug plan as well. That is option 2. The option 3 package is that you look at a Part C Medicare Advantage plan. And oftentimes, Medicare Advantage plans come with prescription drugs. They cover all the benefits that Original Medicare covers, at least a minimum of what Original Medicare covers, if not, most cases, better. Now let's talk a little bit more about Medicare Supplement insurance. Medicare Supplement insurance, also called Medigap. This can fill some of the gaps that Original Medicare does not cover. It can cover deductibles, copays, and coinsurance. You have the freedom to choose any Medicare-appointed doctor in the in the U.S. standardized plan letter with associated services. Has a monthly cost associated with it, which will vary based on insurance companies. Now, don't forget, they do not cover prescription drugs, so you will want to couple your Medicare Supplement plan with a PDP or a prescription drug plan. If you would like to, I would suggest snapping a quick shot of this Medicare Supplement options list. This provides you with an understanding of what is covered underneath the Medicare Supplement plans. An important fact here with Medicare Supplement plans is that they are all standardized. So no matter what company you decide to go with, all the benefits, whether you're on Part A, you're on Plan B, Plan C, D, F, G, K, L, M, N, sounds like I'm going through the alphabet there, but no matter what plan you're on, they'll be standardized no matter what company you decide to go with. The only differences you'll look at are the premiums associated with that plan. So whether I'm looking at Company A or Company B's Plan G, they'll be the same benefits you see on this chart here, but Company A and Company B might charge a different premium for the Plan G. Now keep that in mind when you're looking at your options. Medigap Plan C and Plan F disclaimer. Plans C and F are no longer available to those who were newly eligible for Medicare on or after January 1st of 2020. Medicare Advantage plans. These are known as Part C plans. They're offered by private insurance companies. They include benefits from Medicare Parts A and B and additional benefits not included with Medicare. They often have low to no plan premiums involved. They do have a network of doctors. They have co-payments, co-insurance, and deductibles involved. And they protect you with limits on how much you can spend on health services each year, both in and out of network, known as a maximum out-of-pocket. Now, often these Part C plans, Medicare Advantage plans, come along with RX coverage or prescription drug covered included inside of them. There are some exclusions, like MA-only plans, which are typically good for veterans. These plans can also offer other benefits, such as dental, hearing, grocery card and benefit, and over-the-counter or OTC benefit, vision benefits, flex spending cards, gym memberships, transportation. All these plans differ, and you will want to make sure that you're going through those options to see if they're available to you. Eligibility for Part C plans is that it does require you to be entitled to Part A and enrolled in Part B to be qualified for these plans. You do need to live in the beneficiary must live in the MA's plan service area, which typically means you will need to live in the county in which this plan is available. There is no medical underwriting for any type of Part C plans, and you do need to enroll in a valid election period, which is typically the IEP, the 7-month period of when you can first get onto Medicare. You can enroll into these plans. You can look at the AEP, which again is October the 15th to December the 7th, or an SEP. Let's say you were on your employer group plan and you decided to leave. You're now granted an SEP for 60 days, and you can look to enroll into a Medicare Advantage plan at that time. Inside these Part C plans, you typically have two really well-known plans. The first one is an HMO. HMO plans are restricted to a list of network providers. What this essentially means is that you're going to have a smaller network of doctors, providers, and hospitals that you can use. But because of the sacrifice of having a smaller network, you tend to have richer benefits. Richer meaning lower costs to you. So beneficiaries are subject to 100% of the costs when they go out of the network. These plans have very rich benefits when you stay in network. And HMO plans typically have lower co-payments, co-insurance, and lower maximum out-of-pockets in comparison to the PPO. The PPO has a larger network of doctors, physicians, and hospitals that you can attend. They sometimes have out-of-network options available where you can go out of the network too as well. PPOs have a maximum out-of-pocket limit in and out of the network. They have a greater cost savings when you use in-network physicians. You do not need a referral to see out-of-network providers. Regional PPOs are PPOs that serve an entire region made up of one or more states. Now for our veterans out there. Veterans will be looking at having Medicare Part A coverage only, and they can use the VA for health and drug coverage. If a veteran decides that they want to have Parts A and Part B with additional coverage, they can always look at a Medicare Advantage plan. They can either do an MA-only plan, which doesn't cover prescription drugs, and they would just need to use the VA for their prescription drugs, or they can get a MAPD plan, which would then cover them at private locations if they wanted to for both Medicare coverage, medical coverage, and prescription drug coverage. Or they can look at a Medicare Supplement plan if they would like to get any type of insight from doctors outside of the VA hospital. So let's go into prescription drugs, Part D plans. So there are two types of Part D coverage. There is the standalone prescription drug plan that you would look to purchase if you had just Medicare, or if you had Medicare and a Medicare Supplement plan. You can also look for Part D coverage if you were to get a Medicare Advantage plan that had Part D incorporated inside of it. Part D coverage information covers some prescription drug costs. You must be enrolled in Part B and continue to pay your Part B premium, and you must live within the Part D's plan service area. When they say service area, they typically mean the county. Now, in 2025, there have been some major program changes that have happened for the Part D plans. For 2025, there will be changes to the Part D program as a result of the Inflation Reduction Act, impacting both the standalone Part D and the Medicare Advantage prescription drug plans. It is important that you are informed on these changes to help members understand how they may be impacted and be prepared to support them. In 2025, the Part D overview, the elimination of the coverage gap. So in 2024 and beyond, there was this well-known coverage gap, the stage in which the client or the consumer would have to be paying out of pocket for a good portion of the prescription drugs once they got into the coverage gap. Well, the coverage gap stage or the donut hole is going away in 2025, and members will now have 3 drug payment stages as part of their Part D benefit. Stage 1 is the deductible stage. This is where the members pay, or the members plan has a prescription drug deductible, and the client will pay the full cost of their drugs until they reach the deductible amount. Then they move to the initial coverage stage. 2, the initial coverage stage. This is where members will pay their plan, co-payments or co-insurance, and the Part D plan or manufacturers will pay the rest. Once the member and others on their benefit have paid a combined total of $2,000, including any amounts paid toward the deductible, they move to the catastrophic coverage stage or stage 3. Members won't pay anything in the catastrophic coverage stage for Part D covered drugs for the rest of the plan's year. The Part D plan will be responsible for most costs in this stage. In this graph, you'll see an example of what we had just described. So in 2024, the individual had 4 stages. The deductible stage, where they paid 100% of the deductible. And then in the initial stage, stage 2, the client would pay 25%. The Part D plan would pay the remaining 75% in stage 2 to a certain cost. Once a certain cost threshold was met, they'd go into the coverage gap, where the member would pay 25%, the Part D plan would pay 5%, and then the drug manufacturers would pay the remaining 70% until a specific threshold number was met. Once that number was met, you would go into stage 4, the catastrophic coverage, where now the Part D member would pay 0 in catastrophic, the Part D plan would pay 20%, and the Medicare would pay the remaining 80%. Well, this has obviously changed in 2025. The member will be responsible for 100% of the deductible in the first stage. In stage 2, the initial coverage, the member will be responsible for 25%. The Part D plan will be responsible for 65%, and the drug manufacturers are responsible for 10% in stage 2. Stage 3, the catastrophic coverage, the member will be responsible for 0. The Part D plan were responsible for 60%, drug manufacturers 20%, and Medicare the remaining 20%. So in 2025, there is a new $2,000 annual true out-of-pocket maximum, reduced from the $8,000 that it was in 2024. The TROOP, or true maximum out-of-pocket, is the out-of-pocket drug cost that accumulates during the deductible in the initial coverage stages. As a result, members may reach the catastrophic stage more quickly, where they will have no drug cost responsibility due to the elimination of the coverage gap in the lower true maximum out-of-pocket. Here we're going to provide you with a bit of an example. Let's say that the member's plan cost share is $20. There's a defined standard plan cost share of $40. In example 1, the $40 is what's applied, the true maximum out-of-pocket. Again, you might have spent $20 when you go to pick up your prescription drugs from your pharmacy location, but the actual cost of the drug was $40. The other $20 was picked up by the Part D plan. So that $40 is what's totaled towards your true maximum out-of-pocket. In example number 2, the member plan cost share is $47. The defined standard plan cost share is $35. In example 2, the $47 is applied to the true maximum out-of-pocket because it is the greater amount. They'll be totaling those costs to get to your $2,000 maximum true out-of-pocket costs in 2025. Part D also has a late enrollment penalty. So whether you're taking prescription drugs or not, it is always advisable to make sure that you are a part of a Part D plan or on a Medicare Advantage plan that has Part D coverage. If you did not sign up for your Part D when first eligible and did not have any type of credible coverage for more than 63 days, you may have to pay a late enrollment penalty for as long as you have Part D. The penalty is 1% of the national base premium, which in 2024 was $34.70, multiplied by the number of months you were not covered while eligible. So late enrollment penalty of the 1% multiplied by the national standard Part D per month, well, that number could look like this in this example. Mr. Smith misses his IEP at the age of 65 and goes without drug coverage for 10 months. Mr. Smith will be responsible for the $34.70 times 10%, which equates to $3.47, plus his monthly premium each month. So for the remaining of Mr. Smith being on a Part D plan, he'll be paying an extra $3.47 a month for his Part D coverage they would have not had to pay if he had just got onto a Part D plan at the appropriate time. And that's what leads me to our services to you. You can use GBL services to be able to look at your Medicare options, and it doesn't cost you anything more or anything less by having us assist you than by going straight to the carrier themselves. What we do is we provide you the opportunity to look at a neutral perspective of where we are going to have multiple carriers and not just one carrier to look at your options, whether those are Medicare Advantage plans, prescription drugs, or your Medicare Supplement plan. We'll look at those options and we'll compare those two as well with what you have for your group employer plan and find a need that fits, find an option that fits your needs, because each individual Medicare recipient has different needs. And that's where we like to take our pride in is finding a good option for you and your family. So you do have many options for your coverage, and you can continue with your employer plan if you're still working for an employer with over 20 employees. You can look at continuing with your retiree or your military plan if it's applicable. You can look at enrolling in a Part C Medicare Advantage plan, or they can include a Part D plan or prescription drug coverage, or you can enroll into a Medicare Supplement plan and a standalone Part D plan on its own. Again, any of those options would be able to suffice, but having the assistance of the GBL team can help make sure that you aren't paying any type of late enrollment penalties and you're finding something that does fit your needs. We'd like to thank you for your time today and hope that this presentation was informative and gave you enough fluency to be able to speak the language of Medicare moving forward in 2025. And we look forward to speaking with you soon. Thank you so much.